A huge breakthrough. Now, remind us of your sister, what she went through.
The reason I'm part of this segment, and we talked about this on TV before, it was 2015. My sister, Anne Marie, there she is. She was diagnosed in April of 2015 with metastatic melanoma. By April, that was April, by August, she was gone.
Yeah.
But she had had a lesion back in 2011. She had had it removed, thought everything, but she went to get skin checks a couple times a year because she was susceptible. And yet still, apparently, it was there, and it was inside of her, and it was pretty shocking. So with the news of possibility of a blood test, we're very obviously interested in this.
Dr. Harold Farber is with us right now, board-certified dermatologist. Doctor, good to have you in here.
Thank you very much.
So we keep saying a simple blood test. Are we just saying to take a vial of blood and check it?
No, so this is still in the testing stages. It'll probably be available in about 3 to 5 years.
Oh, 3 to 5.
Yeah, what this will do is it'll test for antibodies. They found that of the antibodies produced in the body against a melanoma, there are about 10 of them. And those 10, if caught, can actually predict an early melanoma.
What is melanoma? We always just say it's skin cancer.
Exactly. Melanoma is one of the deadliest types of skin cancers. It's the pigment cells that go awry and start to proliferate and spread throughout your body. The key to melanoma, early diagnosis.
Yeah.
If you remove it at an early stage, done deal. It's gone.
And so that's why this could be so game-changing if we could get
Absolutely.
this ahead
Absolutely.
of the game.
But in a case like my sister's, where you had something removed and then, you know, you kind of want to just keep up on things, would this test, if it had been in existence, have helped her, do you think?
So bear in mind that this test in the study is actually caught about 80%, so 20% would be missed. But the reality is,
good odds.
but it's still better odds. If you had done this test and this test came back positive, it would have been told you that there is a melanoma, and it would told you to keep looking.
Get that treatment
exactly
as soon as possible.
Have the area removed.
It just seems like, okay, you got this little, you know, black thing on your skin.
Right.
How that does so much damage to your insides.
No, that's true.
It's incredible how quickly it spreads, isn't it?
It's amazing how quickly
What does it cause? Does it cause? Didn't Anne Marie have a brain tumor then?
Yeah, she thought she had a sinus headache that wasn't going away. All of a sudden, she had 2 brain tumors. Then they looked at the rest of her, and it was everywhere.
That's from melanoma?
Correct. So the most common area, melanoma, stays on the skin. It grows on the skin.
Yeah.
There's a certain point in time where it then spreads throughout the body. While you catch it while it's still localized on the skin, complete cure.
Because it go into your organs.
Correct. Once it spreads, in the most common area are areas such as your brain.
And Doctor, what's the research? Does it run in families? Does it tend to run in families?
There are risk factors. So risk factors most common is excess sun.
Right.
A family history of melanoma, a personal history of melanoma. If you have a lot of pigmented lesions, greater than 100 pigmented lesions, if you have a lot of atypical appearing lesions on your body.
So this blood test could be great for somebody with all these risk factors.
The standard is still visual and a biopsy. But that, you have plenty of people who have a lot of pigmented lesions. And sometimes it's very hard to know which ones to biopsy, what to look for. This test could be a game changer.
You know, I don't think a lot of people go to dermatologists even until they see something. Should we be going on a regular basis anyway?
The ideal is be aware, be proactive. I would strongly suggest checking at home, self-exams. If you see anything that changes, that's really important.
ABCDEs, right?
ABCDEs,
And watching the moles on your skin.
What's asymmetry mean?
So asymmetry, if you cut the mole in half, and one half looks different than the other half, that's a warning sign. If the border is a little bit different, if the border is splayed into the surrounding area, that's something that should be alarming. Color, it should be an even color, but if there's browns and blacks and red, varying colors, that's an ominous sign. The diameter, if it's greater than 0.6 millimeters, and 0.6 millimeters is about 1/4 of an inch, the size of a pencil eraser, that's an alarming sign.
Then what's evolution mean?
Evolution is change. So if the mole is changing, that's an alert. Do self-exam at home. Go to a physician who's confident.
Well, right, because you can't see the ones that are on your back.
Absolutely.
So you need somebody to watch those.
So, Doctor, I know that you mentioned that this is still a couple of years out, this blood test, and you mentioned it's about 80% it's able to detect if there actually is.
That was the study results, yes.
So at the rate, or the way it is right now, is this something you could see you using in the future when it comes out?
In the future, it would be nice if you can increase those odds. If they look perhaps at the antibodies and increase it from 80% to 90%, that would be nicer.
Can you get melanoma on a part of your skin that wasn't exposed to the sun?
Absolutely.
That's
You
what
can get
happened to my
melanoma
sister.
on the
Yeah.
membranes behind the eye, in the vaginal
Oh.
area, in the anal area.
What?
You can get melanoma anywhere where there's membranes, where there's potential melanocytes or pigment cells.
Yeah, we didn't realize how much we didn't know until all this happened to our family. So,
Thank you, doctor.
Lots to look forward to, at least in the future.
My pleasure.
Well, we're going to take a break now, but when we